So I want to address a couple things. For one, about the supply chain issue, we have to at least take into account the fact that for the last 30 years, corporate interests, including CEOs, have moved our supply chain to China. That was against the wishes of the American working class, and entire sections of the economy were devastated by that. And now we're seeing those policies come to fruition. But there's also a second component to this, and it's called the lean philosophy, which is another corporate manufacturing model where you save money and increase the bottom line by redlining your staff and redlining your supply. That is something that James Hereford is a disciple of, the CEO of Fairview Hospitals. So, it's, yes, of course, we don't want to point fingers and point blame, but as medical professionals, if we don't diagnose the problem in a very objective, concrete, and energetic way, we are not doing service to our patients. And so, yes, I would hope that all the CEOs come to the light of day and invite us into the decision-making cores that they are now sharing and keeping us away from. I hope that the CEOs come down to the ER and help us transport beds out of what I'm calling COVID row. I hope that. But there is no way I would treat a patient on the basis of hope. I treat the patient on the basis of the science and the needs of that patient and our best understanding and needs as frontline medical workers to get the best diagnosis. So at this point, unfortunately, a lot of that bureaucracy, and there's a lot of it, is acting as a prohibitionary mechanism from us to giving that kind of care. And that needs to be directly addressed and not just be given lip service and subjective kind of expectations.
Can I just ask a question before you step away?
Yeah.
And just earlier, sorry, you mentioned the stadiums, arenas. Is that because you think we're going to see so many patients and kind of miss the other point of the comments?
Yeah, the point of the comments is that we are so far behind catching up with the trajectory of this issue that we are going to be overrun. And a lot of people want to calm this issue, and a lot of people have a lot of political reasons, including self-promotion, to make sure that this issue is not being addressed frontally. I'm suggesting, as an ER nurse, that tomorrow morning at 7 a.m. we'll be at United Hospital facing this front on, that we do not have the capacity to do this. We have brought this to hospital administration forever. I can't even remember when the last time since this was brought up, months. They're like talking to a brick wall. We have not expanded staff. We have not expanded facilities, and we haven't even started talking about getting people in for overtime. We might be drafted to do that. And what I can't afford as an ER nurse is to allow a problem to become worse before it is addressed frontally. And that is absolutely what I'm saying. We need to expand our capacity. I mean, we can go halfway around the world and declare war on Afghanistan and Iraq and erect hospitals halfway around the world, but we are not doing that in St. Paul or anywhere in Minnesota. So, yes, I'm absolutely calling a red alarm on that, that we are, again, falling behind the eight ball, and that kind of capacity is imminently necessary.
Are you a union nurse?
Sorry?
Are you a union nurse?
Yeah.
So the question is, to follow up with what John asked you, you're just suggesting U.S. Bank and XL. There's that's nothing official about that,
Oh, I wish to God there was something official about that. No, there is nothing official about that. But look at all of the empty structures across the city and ask anybody, go to any ER and ask anybody. Is this edifice, is this building sufficient to what is about to come? They'll tell you.
Well, folks, you heard it right there from Cliff's mouth. This is the reality of the nature of things right now. If you want to contact James Hereford yourself, like we have done on multiple times, here are his email addresses. Go ahead and reach out to him. Ask him why he's doing the things that he's doing. Why isn't he bolstering staff population? Why isn't he communicating plans for overtime? Why hasn't he been stockpiling materials and supplies? What exactly has he been doing to take care of the community, as he says he has done so many times? Contact Penny Wheeler, the CEO of Alina Health, and ask her exactly what is she doing to help thwart this pandemic. What do her equipment stores look like? How is she going to upstaff her hospitals? You can contact Tim Walz, the governor of Minnesota, and ask him what he's doing. Take a moment to share this video with all your friends. Like us on Facebook, like us on YouTube, follow our channel on YouTube, and finally, reach out to us. We want to hear your stories. Contact WDTW@gmail.com. Hit us up on the Facebook. Talk to us on Twitter. You will always be anonymous. We'll bring you more in the future.